Radio Australia with Phil Kafkalutis. On air weekday mornings from 7:30 in Port Moresby, 5:30 in Hong Kong. radioaustralia.net.au.
Coming up, Sound Body, talking about sports injuries.
This is Radio Australia.
I'm Phil Kafkalutis. It is 26 minutes to 10 in Port Moresby, 26 to 7 in Vientiane on 96 FM. And it's hello to Dr. Ron McCoy from the Royal Australian College of General Practitioners. How are you?
I'm good, Philip.
Good.
I'm good, Philip. Can you hear me now?
Yes. So, sports injuries, you had to deal with many of them in your years?
I think it's actually a very common thing in general practice, and it's an area which a lot of general practitioners have an interest in. And there's also been a rise in sports physicians in Australia, because I think it's partly because I think Australians are sports mad, but I think that there can be so many specialised injuries. And I think, musculoskeletal injuries are very challenging, and we just think, it's just a strain, but it's obviously a lot more than that. It's really quite complex. You think about all the bones and all the joints and all the tendons in the body. It's not easy.
It's not easy. We are joined in the studio by Dr. David Bolzanello, who is a sports physician with Alphington Sports Medicine. How are you?
Good morning. I'm good, thank you.
Yeah, so you've seen obviously a lot of people over your years. You've been doing this, for quite a long time, haven't you?
I have, yes.
Yeah.
Nearly 30 years now.
Yeah. We're going to go through some of the different injuries you get. And a person that I've known for many years, Craig Phillips, who's a Melbourne-based physio. Currently, he's working in the UK with the English Institute of Sport and with some FA clubs in England as well. Craig, how are you?
I'm good, Phil. How are you?
Yeah, really good. It sounds like it's either very early or very late there, Craig.
It's very early, mate. Yeah.
Oh, my goodness.
Up after midnight.
It's up, yeah. It's 9 hours now? Or?
Yeah. Oh, wow. Okay. Well, look, thank you for staying up for us, Craig. Appreciate it. Well, look, let's talk about some of the injuries. Yeah, World Cup preparation. That's right. You've got a few games you've got to be watching.
At 2 a.m, yeah.
Yeah. Look, I just saw today, we're going to get to ligaments and tendons and hamstrings and all that. I just saw today, and this might be something that all three of you have come up against, a rugby league player with the Maroons just got a broken cheek, right? And he said if it was a case of playing would only further damage the cheekbone, then he would play. He said, but he's been told he could lose his eyesight. So he thought about that and he thought, well, okay, no, I better not play. That, to me, is obviously something that all three of you must come up against when you're talking about athletes. You know, they want to get on the field no matter what. Yeah?
Correct.
Yeah.
Oh, yeah.
And it's one of those things, like in general practice sometimes, you'll get people coming in with things like drug-seeking behaviour and would say, I want this tablet. But I tell you what, they're much easier to deal with than the sports people who want to go back on after an injury. Go, but I really need to go on for the team. And you have to say, look, it's really not a good idea. And then in the end, you just have to say, no, you can't do it.
Yeah.
Do you know what I mean?
Well, that's right. I think that's where the art of medicine comes in, is knowing, judging the person, the situation, and the injury, and whether the athlete can continue to participate safely with that injury without long-term harm. An example I had this week was I'm involved with the national football competition at the moment, the under-18s. Young player, very tiny undisplaced fracture in one of his finger bones. Now, with appropriate splinting and taping, I was quite happy that he could continue to play without compromising the healing of that fracture and the long-term health of the hand. Technically, that's a 6-week injury that needs time to heal. But for him, who's wanting to progress through that elite pathway and potentially be drafted, that could be career-ending. So it sounds cavalier, but as long as you follow the right principles of medicine, firstly, his long-term health, and that's the priority, that's where you can break the rules in inverted commas.
Craig Phillips?
Yeah. Well, we sort of get the same thing here, and I guess we're looking at the other end of the scale, which is the recurrences of injuries, and the fact that a lot of these injuries become chronic, and as David says, coming into a career, and something that starts off small, these injuries continue on, and it's like, they've gone and done it again. They've done it again. It's the recurrent hamstring, the recurrent ACL. And that's actually a hot topic over here. Well, it's a hot topic in Australia. But, one of the things we're looking at here is looking at these causes behind injuries, and a lot of the extensive injuries that you see, the knees that keep on rupturing is something become a big area of interest. So we've got to do something different, and actually sort of keep from becoming these clear-ending injuries. They just keep on recurring, and this is part of the job plan over here at the moment.
Yeah.
So I think, Craig's, one of the things that it's a challenge is that often for players, they feel pain, and pain can often settle fairly quickly, but often in order to really be able to re-establish long-term function, there's often an important period of rehabilitation afterwards. I mean, a good example that we have in general practice, and I mean, everyone here will be familiar with this, is the people with the classic sprained ankle. And it's really important to provide proper rehabilitation, get them to particularly a good physio to organise a proper program of rehabilitation, because one of the things that happens is that these ligaments, which are this gristle that holds these bones together, there's nerve endings in them. And when you get a tear in, sometimes you'll find that the joint has to be re-educated. A lot of those nerve endings are how our body perceives where it is in space. Have you ever wondered how a dancer can dance, or people can move in the dark with their eyes closed, because they can still feel where their body is in space? And so if you get injuries around ligaments, you can get injuries to nerves. And if your body can't figure out where your ankle is properly, it's going to re-injure itself the next time. So this rehabilitation period, often in a time of painlessness, is really important. People really want to get back on the sports field.
Yeah, and Craig, you know a bit about that. You're a former dancer yourself, and you treat a lot of dancers, don't you?
Yes, we still do. That was 30-odd kilos ago now, Phil.
You still look great, though, Craig. You still look great, yeah.
Oh, thank you very much. The proprioception side of it is a big one. And
actually, Craig, the line is really bad. What we might do is call you straight back, okay? We'll give you another call.
Yep, okay.
We'll call you back. Yeah, we just couldn't hear you then. Okay, David?
Taking up Ron's line about the rehabilitation, it's really important. And the other message here too, it's not just about the elite athlete. It's not just about getting on the ground. The person who enjoys walking 5 to 6 kilometres a day, which is really, really good for their health. It's the poly pill. People have been talking about the magic pill that can look after blood pressure, cholesterol, diabetes, bone health, and mental health. Exercise is the poly pill. And so if you do unfortunately sprain your ankle,
even exercise, just doing the walking.
We at the college we changed the term. We talk about physical activity now, because people often think exercise and
means
sport.
Sweating yourself.
Yeah,
crazy
and it's basically just about being active. And there's levels. I mean, of course, if you can get up to that level of encouraging people to be that sort of level, and also participating in sports is a lovely social way to really be physical.
But you don't need to. You don't need to be doing combative sports or whatever. Walking, as you were just saying.
Walking, cycling. But if, as Ron said, if you sprain your ankle and you've got that feeling that your ankle's not quite right, and I won't go for that walk today. I don't want to roll it again. That's bad. So actively looking after that problem is an investment in your health in 10 to 20 years' time.
Should you? I've rolled my ankle when I've been walking, just rolled it off a footpath, and there's a little bit of hurt, but I keep walking and it goes away. Am I being stupid here, or have I caused a long-term injury?
No, and the evidence is that probably that's the therapy, is to continue sensible activity.
Why? What is it? Because when you do sprain your ankle, you've actually torn a ligament, have you? Or what are you doing?
Well, the good thing about ankles is that the ligaments are on the outside of the joint. So if you walk in a straight line, in a good shoe and good surface, you will be all right. And for the very minor injuries, usually the proprioception will return. For anything more, an injury that actually requires you to rest your ankle for a few days or more, should be seen and actively rehabilitated.
So just the quick roll and think, oh, what have I done? You walk and then you're fine. That's okay. But all of a sudden there's a sprain. You think, oh, I can't walk. Oh, this is really sore. When you need to see a doctor, every one of those should go to rehabilitation.
So you don't walk on it in that case because you could be doing more damage?
You'll get advice, and usually...
I mean straight away. I'm talking about once you've done it.
Usually what happens... look, unless it's a very, very high-grade injury, often that initial sprain, you'll be able to walk home, and then the swelling will set in, and the next day you're sore and swollen, you can't wait there.
Yeah.
and that just reflects the grade of injury. I mean, the scenario you first said is a low-grade injury, and you're actually exploiting biology by continuing to move and sending normal signals into the cells of the tendon. You're actually asking them to wake up and repair.
Yes.
Interesting.
Which is rest doesn't do.
There was a word that was used earlier called proprioception. Now, a lot of people might not even know what that means, and it's one of you know all the senses like sight, hearing, taste, and being able to use the internet, all those senses.
Yep.
There's another one, an invisible one, and we have a few more, and we call it proprioception, and this is the way in which the body perceives its position in space. And it's absolutely fascinating and the joints, there are lots of different ways in which we get this sense. Our inner ear gives us our sense of balance where we are, and our vision does help. But a lot of it actually comes from nerve endings around the end of joints. And we actually test this as doctors. We can get people to close their eyes. You can do this on the radio at home.
Yeah.
You can close your eyes and someone else, and you can actually move, say, the tip of one of your fingers up and down. And if you hold it particularly on the side, you can actually still know if you're moving up or down without looking at it, because the brain can actually perceive where the different parts of the body are in space.
Yep.
And this is terribly important for sports people, because they need to be able to move a tennis racket or to jump for something without, their eye will be on the ball, so they have to know where the rest of their body is. And it's a very, very subtle sense, and it's terribly important. This is the one that often gets disrupted in these sort of injuries.
Yeah, the way I explain it to patients is if you had to actually think where your foot is, you'd walk like a robot. Step. The servers would tick away. Next step. The classic one is, Doc, I can't walk on cobblestones. The last time I went to Rome, my ankle kept rolling over.
Yep.
Or I'd hate going to the beach.
Rocky ground and the sand, yeah.
And so that means what, that they're not connecting?
Those nerve endings are not sending messages to the spinal cord, which is then sending messages back to the muscles to control the joint fast enough.
Wow.
But you can actually retrain that. And people like Craig are experts at doing that.
Wow, that's interesting. Yeah. What about long-term harm that happens? I remember I did see one of my football heroes some years ago, and he was he was like a ballet dancer on the rugby league field. And when I saw him years later, he was sort of hunched over. And you would have thought, after spending 17, 18 years of his life training his body and, getting all the physio and everything, he was really in a bad state. Now, it might have happened anyway, but I had a feeling that it was because of his playing career.
I think you're probably right. That's the dilemma of high-level, competitive, combative sport. That unfortunately, some of these athletes do end up with long-term injuries, arthritis of the hip, knee, ankle if they've had serious injuries in the past, and it is an issue that we have to deal with, and it's an issue now that certainly at AFL players get counselling about, and importantly, Well, let's digress. If you ask those players, and I know a lot of them now because I've been in the game for a long time, in their 40s and 50s who've had a hip or a knee replacement, would they, knowing now what's happened to them, not have played football? They'd say, no. What I got out of playing, in terms of their enjoyment...
It was worth the wounds.
It was worth the wounds. But the important thing is, and the responsibility of professional sport and sports physicians and doctors who are engaged in sport, is to participate in how we minimise that long-term risk.
We've got Craig Phillips back again, who's a Melbourne-based physio. My guests are Dr. Ron McCoy from the Royal Australian College of General Practitioners, Dr. David Bolzanello, you were just hearing from then, a sports physician with the Alphington Sports Medicine, Craig Phillips with DMA Clinical Pilates here in Melbourne. Craig, we've just been talking about the long-term harm that comes sometimes with playing sport and some of the issues with arthritis, muscle injuries as well. Do you get long-term injuries to ligaments and muscles, that kind of thing?
Yeah, we certainly get a lot of that sort of thing happening. I guess this is the recurrence rate thing that we're looking at with sort of stopping them recurring with long-term use. And it's actually, something we've been testing out over here quite a bit. We can actually sort of test their function and proprioception, and that's actually where we're getting... Sorry, I've just been running up the stairs.
Very good. We've just been hearing that's a very good thing to do. Yeah,
incidental activity in your daily life.
No, suck it up. Keep talking.
House, stairs, so I've gone to the top of the house so I get a better signal.
Oh, okay.
But, what we've been doing is looking at a lot of this work that we've been doing with dancers for many years, and finding that things like ACL injuries in dancers are far lower because they've got better proprioception. So all this, nerve and ligament muscle actually functions much, much quicker in the dance population. And this is now carrying over, putting this into the sporting population, finding we get the same response. So.
And so with something like
injuries,
like with an anterior cruciate ligament, which is something that we see happening all the time, don't we? See it so often in all kinds of sports. Yeah.
But Craig is right. There's been some good studies, and particularly in netball, on landing drills, because it's the landing usually netball that injures the ACL and the ankle.
It's the classic.
And in a program like a professional AFL club where it's more about the structure of the play and the set plays and the drills, it's often hard to find time. But if you put those interventions in, and dancers rehearse enormously. I mean, compared to footballers, the rehearsal is the main part of their performance. So they rehearse these things. Whereas footballers...
And they're cutting...
There is good evidence that intervention programs based on balance, at proprioception really, works.
Yeah. Craig?
Yeah. And we're sort of... we're moving this even further at the moment with screening tools, and this is probably, as David would know, it's one of the biggest things at the moment out there is how do you screen athletes for injury prediction? And what they're actually doing over here is sort of throwing it all out up in the air and saying we've got to come up with something similar. And it's almost taking the Apple model of simplify, 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 because we've ended up getting so complex in how we're managing and screening athletes that we're often missing the elephant in the room. And there's some very exciting stuff going here at the moment, is finding these key factors that are actually predicting when these injuries are going to occur. So then you can set up your rehab even more specifically. And, just with the cost of the players here, it's very, very exciting what they're planning on doing.
Well, we're talking today about injuries because we've got the Soccer World Cup coming up in only a few hours before it starts again. You're working, Craig, with some FA Cup clubs there. So are there particular injuries that are coming through or that you're aware of or that soccer players really are more susceptible to?
It's the same sort of things we see with the Australian rules players, hip injuries, ACL injuries, different mechanisms. I mean, they're not allowed to bend over and pick up the ball here. So you sort of see different injuries in some of those respects, or different mechanisms of injuries. And I guess that's the biggest thing. You see the same injury, but there's a different mechanism behind it with certain players, which we're finding, in fact, that mechanism of injury is what's actually dictating how you do different rehab for different players. So you get 5 players with an ACL injury, and in fact, the same protocol for those 5 players no longer applies. So you can be actually very specific to each of those players. And that's probably the big thing we're seeing between, soccer players and dancers and AFL players, for instance, is the fact that the same injury can have a very different rehabilitation approach to get a better output even further. And this is where, just the actual scientific information that you can now get and the computerisation of actually analysing these movement patterns is giving us a far greater insight into saying, right, we can actually get a better outcome for this and actually better longevity, predicting, whether or not they're going to injure themselves again. So it's really looking at the whole fine-tuning of the rehabilitation process, is making it more specific to the patient. It used to be sort of recipes given out that everyone did the same thing. And we find now in the 21st century that you can have the same injury but completely different management processes for each individual person. And it's identifying those key factors at the moment.
I think, Craig, you mentioned hamstring injuries before. The IOC meeting in Monaco recently, which is predominantly, because it's European, predominantly soccer, the soccer player will get a more muscular injury because it's a running injury, whereas the AFL player will get a higher injury in the hamstring because, as Craig said, they're bending over. Chris Judd, Chris Judd was pushed in the back as he was running and suddenly flexed his trunk forward, and the injury is much higher in the tendon. So it's understanding the mechanisms of injury, the benefit of perhaps seeing these things on video, and now high quality MRI where you can work out where the injury is. In AFL, the people who follow the AFL here, there's a little curious paradox where we're having an increasing amount of games lost with hamstring injuries, but fortunately less recurrence. And that's because we're actually now being more conservative, taking longer, respecting the healing time and then the rehabilitation time. And
when you do that, the hamstring can recover, fully?
Yeah, I think the mistakes we made 10, 15 years ago, Craig said, we treated them all the same way. You had a hamstring injury, you were put in that box, and it was 3 weeks. And for the player who was lucky enough to have that minor muscular injury, yes, it was better in 3 weeks. For the player that you didn't understand the side of their injury, and it was at the, say, muscle tendon junction, which we know takes 3 to 4 times to heal, they were coming back and having the re-injury.
Wow.
Yeah.
That's the science of what we do, which is really quite good fun.
And I suppose you guys, none of you would have anything to do with one player that a couple of weeks ago was in a head clash and his teeth went flying out across the field. That was an awful moment to watch, you know. Yes, well, it was ugly. It was ugly.
And what I did with that was at our academy program, I had our managers send the video of that to all our young players with the, and this is a message for our listeners, with the topic, for those of you who don't wear mouth guards, watch this.
And that would have saved his teeth.
Minimise the damage, at least.
Yeah. Awful stuff. Yeah, I know. Oh, yeah. Okay, so that's one of the things about contact sports too, which takes it into a whole new realm that you get with AFL and rugby league.
And I think the thing that, you know, even though we're talking about the so-called horror stories at one end, I think for the amount of participation in sports and physical activity, you know, most people are fine. And so,
very important point.
So don't. I know we talk about this. I suppose the point is that, you know, learn what your risks are so you can minimise them. Know what to do in case something happens, but don't let it stop you from enjoying this physical activity. And particularly if you know, physical activity by itself is great. And also if you find, you know, an organised activity that you really like, doesn't matter what age, just go for it, because the social aspects will also make you want to play more, so you'll be more physical active. So don't let any of the horror stories put you off. Just get out there and really, really enjoy it. I think that's really important to emphasise. Yeah.
Okay, well, Ron, you and I will go out and kick a ball around, hey?
No. I love walking, and I love hiking and
playing a fiddle.
And I actually really, really enjoy like walking up mountains and things. I think I was a mountain person in the previous life.
Yeah, me too.
Fantastic.
Put it this way, it's easier to fix a sports injury than sort out the sedentary lifestyle 20 years down the track, which is, as you say, that's the big horror that's coming.
I have this conversation with patients who'd say, look, my doctor said I probably shouldn't, you know, walk as much because I'll need a knee replacement one day. And I'd say, well, I'd rather you have a knee replacement with a really strong and healthy heart than have heart surgery on a weak heart.
Okay. Guys, we'll have to leave it there. Look, Craig, before we do let you go, we're going to ask all of you, who do you think is going to win the World Cup this year? Ron, you spend a lot of time in Scotland, so you know all about football.
Argentina.
Argentina?
I'm going for Argentina.
Are you really? Okay, David?
Germany.
Germany. Okay.
Yeah. But I'd love Italy to win again.
Okay, you would. Craig?
Well, if enthusiasm of the Poms is anything to go by, mate, they've got it all over.
And some people would say it's all over already, you know?
It's consolation.
All right.
I think I'll go for the English this time.
You will go for the English, will you? Okay, going for the winners.
Why not?
Okay, the favourite. Craig Phillips, Melbourne-based physio, currently in the UK. Thanks for joining us from the UK. You're working with some FA clubs. Good to speak to you. Thanks, Craig.
Yep. Not a problem.
Okay. Dr. David Bolzanello, who is a sports physician with the Alphington Sports Medicine. You've done that for some years. Thank you for joining us.
Nice work.
And Dr. Ron McCoy from the Royal Australian College of General Practitioners.
Ciao.
We'll see you again next week.
Radio Australia.